Thanks, Ian. Well, great to be here. Hope you can all hear me. Just do a quick sound check. Everyone okay?
Yeah,
Great.
hear you.
Okay, I'm just going to share my screen, and then you'll be able to see my slides, hopefully, as well.
Yeah. The slide is loading.
It's trying.
Amazing. How are you, Richard?
I'm really good, Ian. I'm so grateful for you inviting me today. It's a fantastic opportunity, and yeah, just some really hopefully we can share some really exciting stuff today. So hopefully you can see my screen, everyone.
Yeah, we can see a screen.
Please know if you can't, and I will move on. Great. So thank you everyone for joining this session. Oyinda Mola and I know each other from being part of the Learning Network together. So I am Richard Price. I'm a director of the Learning Network, also currently vice chair of the Learning Network. And I have also worked quite extensively in global health as part of my my career to date, but always with an education and training flavour. So what we're going to focus on today, hopefully, is some of that sort of background, some of those projects that we've done to hopefully inspire you and give you some ideas about some techniques and tools that we've used that really helps engage people working with digital technologies and learning technologies. So education through a global lens. I like to start all my presentations with a nice fact. So the fact today is that the amount of healthcare knowledge doubles every 73 days. Now, that just blew my mind the first time I heard that. I couldn't really comprehend just how vast that was. How does somebody that's entering the profession today as a doctor or a nurse or any kind of healthcare professional possibly keep up with that kind of change and transactions that are changing, things like that? So that's sort of one of the big challenges that we're facing at the moment. And the reality is, as humans, as this graph shows, we're not very good at change. We haven't really changed. If you think about when we go back to when we were cave dwellers, we haven't got any better really since that time during the last 10,000 years about how we adapt to change and how we adapt to different things, new technologies, new techniques. And the reality is, particularly with artificial intelligence, technology is almost on an exponential curve, and we are past the point where we can adapt to that. If you think about that sort of knowledge doubling every 73 days, we're past that point where we can possibly keep up with that. So I think, and I really firmly believe, that e-learning and learning technologies have that role to play in bridging that gap of getting our workforce, whether I'm talking about healthcare, but just more broadly, our workforce generally, because we all work in workforce education and training, how we sort of skill them and upskill them ready to meet those challenges, those changes, those demands going forward. So just to provide a little bit more context, some of the big challenges that we're facing in the world right now in healthcare are the stark reality that 1 in 7 people will never see a healthcare worker in their entire life. So if they live to 60, 70 years, if they're lucky, they will never see somebody that can advise them on or treat them and in their entire life. And the reality is we've got these big gaps. So WHO is predicting that by 2030, there's going to be about an 18 million gap worldwide. I think probably a slightly conservative estimate. I think there's probably going to be a much bigger gap than that, given sort of recent things that are happening. And given those sort of challenges, we need health workers that are increasingly adaptable in their skills. And we're seeing a lot of movement of health workers, particularly into sort of, I suppose, what we call the global north. So these are the wealthier countries in the world. So when I talk about lower and middle income countries later, these are World Bank terms essentially to describe countries that are in the global south. So that is not Europe, North America, and Australasia, basically. So some big challenges there. And then underpinning all of these, we've got increasingly, we've got more conflict in the world. We all know about the sort of well-documented conflict in the world in Sudan, in Israel and Palestine. potentially in sort of Ukraine as well, and then potentially obviously in India and Pakistan as well, and things are starting to include seeing increasing sort of trauma taking place in the world, increasing conflict. In terms of healthcare, we've got challenges around antimicrobial resistance. Antibiotics basically aren't working as well anymore because we're overusing them, and there's no new ones being invented. So how do we sort of deal with those big challenges? And then underpinning all of that, you've got things like climate change. We've got rising sea levels. We know a third of Pakistan was underwater last year. And how does a healthcare system, how does any system, whether it's education, any kind of system in the world, deal with that kind of challenge? And then we had COVID-19, we've got disease X potentially coming. We don't know what the next pandemic is, and the world just isn't really ready for that at the moment. So there's some huge fundamental challenges that we're dealing with, all underpinned by this increasingly uncertain world, where funding is being pulled from UN agencies like WHO and other non-profit organisations that are doing such amazing work in the world. So it starts off a little bit gloomy, this presentation, but I promise you we're going to get more inspiring, hopefully, and more positive. So some of the challenges that we see when we're working in countries. So I should say I spent 2 years working with WHO, the World Health Organization, to look at some of their education challenges. And I thought, naively, probably, that I was going in to build e-learning courses and put learning management systems in place. But the reality is, what I faced when I was actually starting to do some of these projects that I was working on with WHO was some places don't have electricity supply, particularly in rural areas. How do you deal with e-learning courses when there is no electricity supply? Wi-Fi access as a result is quite sporadic, and equally the cost of data is really high. So we all have one of these things, mobile phone in our hand. How do we deal with the cost of data with that? In Uganda in particular, I think it's like 4% or 5% of somebody's salary, an average salary to pay for data. It's just not sustainable to be able to pay for data to be able to run e-learning courses on mobile devices. And equally, the sort of device specifications we came across were really quite low end. So when you're looking at sort of putting virtual reality in, for example, or something like that, it's quite difficult to be able to use existing devices to be able to do that. And then the cost of travel as well. So a lot of countries have sort of centralized healthcare education centres. The reality is the cost of travel is just prohibitive for a lot of people, particularly when you've got massive rural populations. So these are some of the sort of big challenges we've been dealing with. But the reality is, this is the good news, virtually everybody I've ever met in the entire world has a mobile device in their pocket. It may not be the latest high-end Samsung or iPhone, but they have a mobile device, which means there is an opportunity here to work with people to be able to do that. And that's exactly what we did. So I worked with a charity called Learn Appeal. This was probably about 10 years ago now we started this work. And Learn Appeal essentially did some work in Kenya, in very rural populations that had some of those challenges around no electricity, no access to reliable Wi-Fi and things like that. And we built, working with a consortium of UK organisations, what we call, I guess they called it the learning capsule, but essentially this was a box that cost about $100 to make. It contained a Wi-Fi router, it contained a battery pack, and a little learning management system sat on an SD card that just plugged into the Raspberry Pi that you can see on the top there. So really, really simple device, very cost-effective device, and the ability to build content that could go onto this SD card that could just be mailed in the post and then plugged in and have that. And you could connect about 100 devices at a time in theory. I think the maximum we have got to is about 25, but in theory, you could have this running in an education centre in a community, and everyone could connect to those devices. So Learn Appeal did some really exciting work in that space. My contribution to this was I built a course on domestic rainwater harvesting. So I'm hugely grateful to the team at Practical Action who provided a lot of the images for this. But as you can see, with a lot of these images, they are quite poor quality and not really suitable for use in an e-learning course. And it was really hard to get subject experts to support with this. And it was really hard to get the quality images to use in an e-learning course. So we used Adapt to build these courses. If you're familiar with that, it's kind of a web-based editor, a bit like Articulate or something like that. Only, if I dare say, better. I don't think Articulate is sponsoring today, so I can say that. But yeah, this is the reality of some of the imagery. It was good, but it wasn't great. So I ended up, I'm quite proud of this. I actually ended up working with a builder to build a rainwater collection in my back garden. So you can see here some of the photos, and this is kind of how we started building that. We built that so that we could use those images within the e-learning, and that's what we did. So sort of joking aside, I think this highlights a real challenge around when you're working with subject matter experts, when you're building e-learning content and things. It's really difficult sometimes to get hold of that expertise and get hold of that content and those images and things like that. So sometimes you have to be a little bit resourceful and start building stuff yourself. So I'm going to give you 4 case studies now, and I should, before I go on to this in more detail, I think one of the big focuses when I worked at WHO was the decolonization agenda. So Uganda famously is, we used to be a British colony, as did a lot of African countries, and it's something that we're not really taught about, if I'm honest, in British schools. But actually, there's a huge sort of legacy of colonization all over the globe, with not just the British Empire, but the Spanish Empire as well, Dutch Empire, French, all of these countries that sort of colonized the rest of the world. So a lot of work is going on to try and decolonize. And what I mean by that is essentially me not coming in as a subject expert in education technology and dictating what is built or created, but working with the local population to upskill them and to be able to give them the tools, the expertise, the knowledge to be able to sustain anything that we do, develop and build anything that we do, develop as part of that piece of work. So the first one I want to talk about is Uganda. This country in East Africa, also known colloquially as the Pearl of Africa. It's a fairly sizable country in terms of population, but it also has a massive refugee population. I mentioned briefly about conflict earlier. South Sudan, for example, a lot of the people came over the border, and it's about 1.2 million people living in refugee camps in northern Uganda, which is putting a huge burden, obviously, on their health system, which is already about 75% rural, and they have a massive burden of trauma. And what I mean by trauma is essentially road traffic collisions. So I think Uganda has one of the highest burdens in the world of road traffic collisions. And obviously that can mean death, but it can also mean sort of serious life-changing injuries. And that was something that we were asked to work with the Ministry of Health there to be able to address that and look at how we could do education interventions to do that. So we came up with a solution that involved virtual reality, and we looked at how potentially we might be able to use virtual reality to be able to upskill people working in rural populations, because I should say there's no ambulance service, particularly in rural areas. So your life chances are quite limited if you are seriously injured or in need of hospital treatment or emergency treatment. If you are in a rural area, it's very likely that you will die. So trauma care is potentially one of the interventions that you can do to try and solve that problem. So we worked really closely with the Ministry of Health here. You can see 2 of the ministers here, Permanent Secretary Diana Twine and Dr. Charles Ayume, both wearing virtual reality headsets, experiencing some of the concepts that we were exploring with them. I should say we worked really closely with a team at Makerere University, who have an amazing virtual reality lab in Uganda, and we published this research here. You can see that link at the bottom of the screen there, and you can see some of the team at Makerere here using their using their headsets, their controllers, to be able to demonstrate some of the things that they had built as part of this piece of work, this project. So we worked really closely with the team there, and Dr. Dalji Jingo, who's an amazing guy, and is sustaining this work now. So that was the piece of work we did in Uganda. Now for something completely different. So again, we worked a lot with Georgia as part of my work. So Georgia is a country in Eastern Europe on the Black Sea. It's a former Russian colony, now an independent country, and again has quite a significant rural population, meaning that we had to look at solutions. So again, this is my naivety. I thought we were going in to support them to build e-learning, but the reality was when we turned up, some of the challenges around what they were trying to do is implement telemedicine. So essentially being able to connect people in rural populations to doctors working in the capital Tbilisi, so that they could get expert treatment, expert care. But the reality was some of the stuff that we ended up talking about was nothing to do with e-learning. So you can see here, this is one of my colleagues who was demonstrating the telemedicine equipment. So you can see here it's a dermatology scanner. And the reality was this all looked great in theory, but the reality was there were some really practical things like the lack of Wi-Fi or lack of reliable Wi-Fi, and the lack of even curtains at the window. So they had an amazing ocular scanner for checking your eyes, but there were no curtains at the window, so they couldn't use it. So there were a lot of things like that we discovered when we started this piece of work that needed addressing before we could even think about training people and how to use the equipment, how to use that. And you can see on the second photo here, I mean, this is the reality again. There was no digital technology for medical records and things. It was all still paper records. So a lot of the work we were doing actually turned into a much more sort of consultation piece about looking at some of the challenges and how we would address those. And what we actually built wasn't a piece of e-learning in the end. What we built was a framework, a competency framework that allowed the team in Georgia. We worked with them to identify their needs, their priorities. We built this competency framework with them to look at what they might need so that they could then take this forward and start building e-learning courses based on that. And that's where they are now. They're starting to develop that work. So again, it's sometimes you go in thinking you're going to be doing one thing and do something different, and that's the reality of working in sort of in the global space. Another really cool thing. Oh, I'm so sorry. This isn't. I thought I'd finished this slide, and I obviously didn't. The Philippines. I'm sure we're all familiar where the Philippines is in Southeast Asia. I must say, adobo is one of the greatest foods on earth. If you've not had it, try it. Find a recipe online and try and build some. Try and cook some tonight because it's amazing. But again, there's a sort of fairly substantial rural population in the Philippines, and again, we kind of went in thinking about what we were going to do in terms of e-learning, but what we ended up doing actually was working on sort of building digital skills of their health workforce, rather than addressing some of the population things that we thought we were going to be working on with the team in the Philippines. So what we built was a digital literacy competency framework to work with them. So Philippines is classed as a middle income country. So it's got some public health services, some public health systems as a result of that. And the team in Philippines worked with us to build this competency framework, because what they have, the difference between perhaps Uganda, for example, and the Philippines is Uganda is dealing with communicable diseases still. So things like Ebola, malaria, those kind of things. They don't have, because they're classed as a low income country, the population generally don't have the money to become to smoke, to become fat, to become all of these sort of lifestyle diseases they might be referred to. So non-communicable diseases, we call them. Whereas the Philippines, it has a sort of growing middle class population and starting to deal with some of those burdens that we are dealing with here in sort of Northern Europe, in particular, and North America. So we worked with the Philippines to develop a digital capability framework to help them address some of those non-communicable diseases. And you can see here on the left is the NCD portal we worked with them on, which contains some e-learning courses around how to deal with sort of interventions around how to have conversations with people to improve their lifestyle to be able to deal with some of these. And I should say we're all wearing masks in this photo because this was at the tail end of COVID, and a lot of countries were still sort of dealing with the fallout from that. Philippines in particular was dealing with that. So yeah, those are the kind of things we do. The final one I wanted to just talk about briefly was Malawi. This is my only slide with this one because this is a piece of work that's still in its infancy. I'm doing this as a voluntary work in my spare time, but I'm working with the Ministry of Health in Malawi to look at how we implement sort of quality improvement e-learning. So for their health workforce, so they're really sort of keen to improve the outcomes, so the way people whether people survive or the quality of life that they have. So we're working with them to work on a quality education framework. So currently we're working with them to put a Moodle platform in place, and working with them to build some content around sort of quality of care and being able to improve that. So hopefully that will improve some of these numbers here, like life expectancy and things like that. So and Malawi in particular has a huge challenge. I think this is the highest rural population in the world. So that people that aren't living in cities like Lilongwe, for example. One of the big challenges is how we get that learning to that population. And this is really where sort of some of those challenges I really talked about at the start around sort of access to education and things really come into their own. So this is a lot of the work that I'm doing at the moment is around that groundwork, building up and working with the team there to be able to look at some of the challenges and how we address those. So I think, like I say, I talked about decolonization right at the start of this talk. And I think that's really key to this. This is not about me coming in as an expert and saying, this is what you need to do, this is going to solve your problem, because I don't know the local context in Malawi. I'm relying on the people that work there that really know their population, really know their health system, really know their country, to be able to say, these are our big challenges, how do we solve them? And essentially that's what I'm doing, working with them to come up with co-designed solutions that work. So really what I'm talking about with all of these projects that I talked about today is working with people and making sure that everybody has the opportunities, everybody has the same, we're working really closely with the subject experts, working really closely with people to be able to make sure that this is right, we get this right, so that the solution that is implemented actually works and isn't going to just stop as soon as the funding runs out or as soon as the key people walk away from the project, for example. So that would be my sort of take-home message. Look after your subject matter experts when you're building learning content, because they are key really to being able to deliver some of this stuff. Thank you so much for having me today. And thank you so much to Uganda Project for facilitating today and for inviting me. I'm really happy to take any questions with any time that we've got left.
Yeah, amazing. Wow, that was really great. I mean, telling the story about the project that you run in Africa. I know a number of things stood out for me. I mean, your last words about taking care of your subject matter experts, that is very, very important. And you said something also that one time you think that when you're starting the project, you have an idea of your design process, what you like to do, and you feel you know what you're going to do until you get into the problem, which makes understanding the problem very, very important. You need to understand what the problem you're trying to solve. You know, learning design is pretty much like product design. If you don't understand the problem, how do you provide the right solution to it? And you talked about co-creating, which is working with the people who really know the problem. Those were the the takeaways from me. So anyone here, what did you take from the session? Okay, Chiju said you were struggling to understand. Oh, sorry about that. Would you be able to share your slides later, Richard?
Yeah, of course, and I apologise if I wasn't very clear in my talking. It may be my microphone.
Honestly, it was clear to me. Maybe it's the network at that side, because I heard you clearly and I was able to follow your story and all. And this is a time where we ask questions. And I shared a link in the chat, which is the link to our collaboration board. Any takeaway from this session, please put it in there. Okay, I think I'll just share the tool here right now. Helps us to, because the best time to put in your takeaway is when you're just done with that session before another session starts, and we have ample time to switch to another session. I mean, before we move to another session. So I'll just organize the takeaways for Kim's session, so we can pick up this, these notes and use. So what I'm gonna do, so let's use this site for Richard's session. Whatever your takeaway is, whatever you took from this session, please put in here on this side of the tree. And at the end of the conference, we're all going to have access to this board so that you can learn from others. So you can take a note like this and just move it over to this side. And once you click on it, you can put in your takeaways. And so Kim says, I love your problem-solving initiative of creating the rainwater collection system yourself. Absolutely. And please, Richard, I love your tip about the food. I've noted the food. Can you put it in the chat again? I'm going to try it out. I'm also from Africa, but not from that side of Africa, so I haven't heard of that food. So I'm definitely going to try that.
In the Philippines, adobo. It's amazing.
Adobo, wow. So this is the time to put in our reflections and ask questions. Oh, it's saying adobe. I think that's autocorrection. Yes.
That's adobo, not adobe.
So let's move the. So for me, it's about taking care of your subject matter experts. I mean, I do learning design, and I also take my students through the process of learning design with subject matter experts. And one of the things that we found out about subject matter experts, there are different types of subject matter experts. You have the ones that know the content, they know the problem, but they have the content to give to you. And some of them, you have to really, really chase them to get the content. In fact, you may have to do research to put the content together. And some of them will work collaboratively with you. And some will say, I don't have the time. You just have to get things done. So dealing with subject matter experts is a very valuable skill in learning design. You have to know how to establish the right relationship with them, the right rapport to get the best out of them. So that's a very valid point to take away. And then co-creating is really, really amazing. You know, get to brainstorm a lot on ideas and all. Cooking with Genius. Thanks for sharing that link. Okay, Bumi JJ said, can you briefly explain the little tech about plugging up to gadgets? Does it send the content to someone somewhere, and how safe is the method? Yeah. Richard, that's a question for you. You're mute. Okay.
If I understand the question, what gadgets are you talking about, Bumi? I'm sorry. Do you mean mobile phones, mobile devices? Oh, so okay. So in the project we did in Kenya with in rural populations, so the box was completely standalone. It wasn't something that it didn't need Wi-Fi, it didn't need electricity. That was the whole point of it. It was designed to kind of work where there was no power, where there was no Wi-Fi, and that was really important to us to be able to create a solution that would work regardless of things. It still needed charging, obviously, periodically and things like that. But the idea was, so it ran a Raspberry Pi, which, if you're not familiar with, is like a little computer. You can buy an open source computer. You can buy on like Amazon or eBay, and they cost like $50, something like that, really cheap. And then you plug it into. It had a battery and a Wi-Fi router, and it was about the same size as a child lunchbox, probably. Had all of that in there, and it literally had a little SD card that ran a Moodle learning management system, and we could upload any school content onto the SD card. And like I say, if we really need to make an update or something, we would just send that in the post. It would then plug in the new version, and then all of the devices connect to that, all of the mobile phones connected to that, and we're able to track the learning on and access the learning completely off-grid.
That's quite innovative, you know. And also it comes with understanding your situation, understanding your learners, what tech is available, what resources are available. You have to make do with what you have. As much as you understand the process of learning design, you still need to, you know, be innovative in your solutioning. That's amazing. Does that answer your question though, Bumi? Do you understand? Okay. More questions, please?
Yes, the plans are available open source somewhere. I forget where. It was on the Learn Appeal website, but I'm not sure it's still there. So yeah, the plans are open source somewhere. It's, like I say, pretty easy to manufacture. It can be manufactured locally. That was kind of one of the points of it as well. It was meant to be simple.
Okay. Okay, so I think our time is up now. That was amazing. Let's show some love to Richard. Please use the react button, use the soundboard, use the emojis, you know, the reactions. Let's show some love and appreciate Richard for that session. That was really amazing. Thank you so much, Richard. And if you haven't put in your reflection, please go ahead and put it. The link to the reflection board is in the chat now, because now we have to, I'm going to have to kick everybody out again. And I'm not tired of explaining this. I believe I owe you that explanation. The reason we do this is so that each session can be recorded individually, and then we can prepare it to be available for you to have access to later. Thank you so much for the amazing session. I enjoyed the storytelling. I enjoyed the practical tips. They were very, very relatable. I think there are some questions, some messages here. So people are saying thank you for inviting. You love the air. Yeah, you're welcome. You're welcome. So we're going to leave now and come back immediately to have the next session by Dr. Nicola. So see you guys in the next session. Bye for now.